dispatched to the scene of a 48-year-old male who was working on a construction site and fell off a ladder that was about 7 or 8 feet high.
Alright, 7 or 8 feet high. Alright, PPE is my scene safe.
Yes.
Pretend I'm wearing gloves. How many patients?
This is your only patient.
Mechanism's injury was falling off a ladder that was 7 feet high.
Mm-hmm.
Okay. And I'm gonna call for additional ALS. And just because he fell from a ladder 7 feet, I'm gonna put him on C-spine, immobilize. I'm gonna ask my partner to immobilize the cervical spine. And I walk in, and is he tracking me? Is he verbal? Can I speak to him?
He is verbal and he's tracking you.
Alright, so he's alert. And I say, hello, my name is Medina, I'm here to you today. What seems to be the problem? Are you feeling any pain anywhere?
So he feels pain in his lower legs.
Lower legs?
And he has some back pain.
Are there any immediate life threats?
No.
Okay. And now I'm going to go ahead and check his airway. Is it clear?
Yes, it's clear.
Okay, airway's clear, and then how's his breathing?
His breathing is regular and deep.
Regular and deep. Okay. And what's his respiratory rate?
His respiratory rate is about 20.
About 20. Just in case, I'm going to put him on a non-rebreather mask, 10 liters per minute. And I'm going to check if there's a pulse present, and what's the quality of the pulse?
The pulse is regular and strong.
Regular and strong,
Mm-hmm.
okay. And then I'm going to check for any signs of bleeding. Do I see any signs of bleeding?
Nope.
And what's the skin condition?
It's pale, cool, and diaphoretic.
Pale, cool, diaphoretic. Okay. And I'm just going to treat him for shock and put a blanket over him just in case. And I'm going to lay him supine. And I would consider him a priority patient. So, load and go. And I'm now going to check his vitals. So, I'll get his pulse rate or his heart rate. What is his heart rate?
About 75.
75? Okay. And his respirations again?
20.
20. And I'm gonna get his blood pressure. Put the blood pressure cuff on, and what do we get?
135 over 70.
135 over 70. All right. And now I'm gonna get a sample history from him. Signs and symptoms: he's feeling pain in the lower legs. He's cool, pale, and diaphoretic. He has normal breathing. Does he have any other signs and symptoms?
No.
Okay. And are you allergic to anything? No.
Mm-mm.
Okay. Are you on any medications currently?
Mm-mm.
All right. And do you have any past medical history?
He had a heart attack about a year and a half ago.
Heart attack about a year and a half ago. Okay. And what was the last thing you ate that you remember?
He had a sandwich a couple hours ago.
What were you doing when you were climbing the ladder?
Working.
Working? Just like at a construction site or at your home?
Construction.
Okay. Now I'm gonna do my secondary assessment, just head to toe. Okay, so I'm gonna start with his scalp and his skull. Do I feel anything?
Nope.
Back of his head?
Nope.
No. Now I'm gonna check his facial bones. Do I feel anything?
Nope.
I'm gonna check his pupils with a pen light. Do I see anything?
Nope.
Okay, and then I'm gonna check his ears, behind his ears. Do you feel
His
anything?
ears are fine now.
Okay, and I'm gonna check his jugular veins. Everything's okay?
Mm-hmm.
And is his trachea midline?
Yeah.
His jaw's okay?
Yeah.
Okay, now I'm gonna check his clavicle. Is that okay?
Yep.
I'm gonna palpate his chest. Is that okay?
Mm-hmm.
And then I'm gonna palpate his abdomen.
Yep.
All 4 quadrants. Okay, is that
Mhm.
okay?
Yep.
And then I'm gonna check his stability of the pelvis
Pelvis is fine.
and his groin.
That's
Okay.
okay.
Then check his legs. He's feeling pain
He feels pain right there.
right on his left thigh,
Left femur, yes.
left femur.
Mm-hmm.
All right, and when I go opposite forces, does the bone stay intact?
There's a little bit of give.
There's a little bit of give. Possible fracture to the femur is a closed fracture.
Mm-hmm.
So I'm gonna have my partner traction split his left leg.
Yep.
And I'm gonna check down below his calf. Is everything okay here?
Yep.
And is his pedal pulse present?
It's a little bit weaker.
And okay, I'm gonna ask him to push up on my hand. Can you do it?
He can do it, but it's painful.
Okay. Push down. Can you push down?
Mm-hmm.
And can you feel what toe I'm touching?
Yeah.
Okay. Alright. And then check his other leg. Is his femur okay here?
Mm-hmm.
And his leg?
His leg's fine.
Alright. Pedal pulse present.
Mm-hmm.
And can you push down
Mm-hmm.
and push up?
Mm-hmm.
Can you tell what toe I'm touching?
Mm-hmm.
Okay. Let me check his upper extremities. So is his humerus okay?
Yep.
Intact? I don't see any hematoma. Decap BTLS. And then anything in his arms?
No.
Pulse. I'm gonna recess the pulse. Is it still strong?
Mm-hmm.
Okay. I'm gonna do the other side. Humerus okay?
Mm-hmm. Feels a
Arm.
little bit pain in his
Pain?
lower arm. Yeah.
Okay. And pulse is still present?
Yes.
Strong?
Mm-hmm.
Okay. Alright, I'm gonna make sure and put him on a collar, and I'm gonna get a backboard ready and ask my partner to help me put him on his side. I'm gonna palpate his back and his buttocks and see if there's any signs of decap BTLS, and then I'm gonna load him on the backboard, get him ready for transport. And on the ambulance, I'm gonna reassess every 5 minutes. I call this a code 2 trauma and bring him to the hospital.